Hey everyone, we're here to do communicable diseases. We are representing Standard 12 by the CFSS. My name is Andrew. I'm here with Binderji and Yuvraj, and let's just get right into it. Standard 12. And one thing to note is that communicable diseases are any illness that can be contracted through contact with human or animals, their discharges, or contaminated items carrying an infectious agent. Fitness service providers are incited to provide an employee training pertaining to the awareness and prevention and control of communicable diseases. Most communicable diseases are preventable, and practicing things like washing your hands and just general tidiness, personal organization are great ways to sort of stave off the risks of communicable diseases when we go out into public places. Lots of potential to spread unless the staff follows particular procedures. And participants and employees should ensure that they have up-to-date immunization, especially, we're very familiar with that now, going back into the world. There's definitely a new normal since 2016. That's about 5 years now. There's been many changes that have caused Ontario to increase their policies on communicable diseases and how we relate to them. And there's a new obligation to service providers to provide a level of service that sort of goes above and beyond what we were initially used to. Like, no precaution is foolproof, and it's you're still likely to come in contact with things like feces, nasal secretions, sputum, sweat, tears, saliva, vomit. We have to be aware of our surroundings and take a proactive approach when it comes to these things. Located in the bottom right is a link for the OASES document that was made available by CFSS regarding awareness, prevention, and control of communicable diseases. The controls, service providers are supposed to provide employees with pertinent training, awareness, prevention, as we mentioned, and a part of this is employing existing controls to help reduce the risk of exposures of workers. Infectious control. There are many ways that we can do this. The employer, it's our responsibility to screen customers and staff regularly for health issues, encourage workers to monitor themselves, ensure workers with symptoms self-isolate, follow municipal laws, share information, knowledge is power. A big part of prevention in reducing risk of potential exposure is eliminating or minimizing exposure. We can do this by physical distancing, which we're familiar with, disinfection and sanitizing, hand and respiratory hygiene. So hand and respiratory hygiene when washing our hands, wearing a face covering if we're going to be around a lot of people and we do feel like there's something brewing in there. Some things to consider regarding your client and customers. If it's flu season and things are a bit hectic, maybe take appointments. Maybe have your customers book online or by phone. Consider limiting capacity, especially around machines. Make sure you clean machines on the regular, things like that. Some things are permanent, some things are as they apply. And that brings up my good friend Yuvraj with precaution.
Yeah, thanks, Andrew. So here we go with the precaution. Here we go with the standard #1. Under communicable disease, declared that the fitness services provider shall provide employee training pertaining to the awareness, prevention, and controls to communicable disease, signs and symptoms of infectious diseases. In that, it is caused by usually the bacteria, parasite, and fungi. The organism can be spread from the person to person or the blood and other body secretion, droplets, and the breath like sneezed, cough. The universal precaution or worker guidelines designed to protect against infection control to the disease is spread by blood and same body fluids. Moving towards the precaution and the definition of what's the universal precaution. And there are the three universal precautions. The first one is like personal protective equipment, which also known as PPE. The purpose of PPE is to prevent blood and blood fluids from reaching the worker's skin, mucous membrane, or the personal clothing. Reasonable PPE should be available at the fitness facilities. And the second one is the work practice control, in which such as hand washing, handling used needles, and more sharp and contaminately reusable sharps, fluid, and tissues collector and transporting approved with the practice safe. The third one is the engineering control, in which is the isolating and removing the hazard from the workplace. So there are some common signs and symptoms, 10 symptoms for the infectious disease. The first one is the coughing, then sneezing, temperature like fever, chills, vomiting, diarrhea, wounds or open sores, malaria, numbers and tingling, balance difficulty, vision changes, and last one is disorientation. Here also we have some like symptoms which we observed in the COVID-19 in this pandemic situation. Moving towards with the awareness and training. Awareness training includes employee orientation to the following information of the communication diseases. Yeah. So the outline for the communication disease is like as a trainer framework from the communicable disease managed strategies developed by Canadian Wellness Matter Awareness and Prevention for the Control of Canadian Health Safety Standard. So which are there some recommended by guidelines in 2005. Awareness training involves the applied tendency for the following information for the transmitted disease, in which the first is the chickenpox, spread from the direct contact with infected people. As you also see in the picture, the person is totally infected by chickenpox. Food poisoning, it is spread through contaminated food or water and with the person contact. The victim is cognitive several weeks after symptoms subside. You can also see in the picture that the person is totally infected in that. And the next one is the fifth disease. This the rashes begin with the slap cheek appearance, which you also can see in the person on the small baby having that affected by that. It is spreaded by secretion from nose to and throat and the containers or until the rest disappear. The hepatitis A, B, and C. Hepatitis A is transmitted by ingestion of food and water contaminated by focal substances, whereas hepatitis B and C are transmitted through blood and body fluids. You can also see in the snap.
Here is a scabies, an organic infection noticeable amidst fingernails, wrist, elbow, skin fold, bangs, lower lip lesions around the belt line. The itching is more intense at night. It is spread through direct skin to skin contact and through clothing. The infected person immediately put on the clothes. The next one is strep throat, and it is the fever, sore throat, redness, and white spot on the throat are the symptoms of this disease. It is spread through direct contact with the infected person. The victim is contagious from the onset of symptoms 24 hours after starting antibiotics treatment. Other communicable diseases are which the outline provide guideline for include emetigo, measles, meningitis, ringworm, scarlet fever, shingles, and tuberculosis. Routine practices, and these are used to prevent skin or mucous membrane contact with all body fluids including blood, secretions, and excretions. And routine practices replaces a combination of universal precautions and body substances precautions. Infections can occur when infectious body fluid come in contact with broken skin, the mucous membrane of the eyes, nose, and mouth, or through sexual contact. Routine practices help protect against all infectious diseases. And here is the hierarchy of controls. There are four types. First one is elimination or substitution, removing the skin of exposure entirely from the workplace. And the second one is engineering controls. These are physical changes in the workplace, such as installing plexiglass barrier at receptions and between equipments. The third one is administrative controls. These involve altering work practices to reduce person-to-person exposure, such as minimizing the numbers of clients in a gym, studio. And the fourth one is the personal protective equipment. And here are 6 steps of routine practices. First one is hand washing. Second, use of appropriate barrier techniques. And the third one is cleaning and sanitizing. And the fourth one is proper disposal technique. Fifth one is not sharing personal items. And the last one is report exposures.
So all of these are extremely important. It's really important that we follow these routine practices. Hand washing being of the utmost importance. Below we see a chart provided by the Government of Canada explaining how to reduce the spread of COVID-19 by washing your hands in this easy 6-step hand washing model. Yeah, so proper disposal techniques of contaminated waste. Avoid sharing personal items, razors, toothbrushes. Use your own. It's good to be frugal, but use your own razors and toothbrushes. And any sort of exposure to any sort of contaminant, report it to your supervisor, your manager, someone on site, and make sure there's proper account of the incident. And thank you for your time. We appreciate that.